Hello everybody, and thank you for joining us today to go through this SASE transition webinar. So today we're looking at SASE transition webinar England only, for adult care, healthcare and childcare. My name's Dion Broughton. I'm the portfolio manager for health and social care, and I have my colleague Raman Granani with me, who is the portfolio manager for healthcare and childcare. Okay, so the purpose of today, we wanted to talk to you about planning for the SASE transition from July 2020. So we're going to look at the SASE transition from the frameworks to the standards and beyond. Okay, so first of all, I want to take you through the current landscape for adult care. Okay, so as you already know, the level 2 and 3 framework for health and social care closed in May 2018. So currently we don't have a framework at level 4. So the only framework we currently have is the level 5 care leadership and management framework that is currently open until July 2020. Now the replacement standard for this framework is the leader in adult care. There is a mandatory requirement for a qualification. I've put the link to that qualification within the slides. What I want people to be very mindful of is that we currently have a qualification in the level 5 framework that will remain for the childcare pathways, but certainly for the adult pathways, they will be being closed down shortly after July 2020. So do make sure you familiarise yourself with the new qualification that is a mandatory requirement of the standard. Okay, so the standard has just been approved, the standard and the assessment plan approved for delivery on the 3rd of February. The typical duration of this programme is 18 months and the funding is £7,000. You can start making that transition as soon as you wish to, or you can wait and make plans to transition in July 2020. Now, the ESFA are not permitting any starts onto the level 5 standard until there is a suitable endpoint assessment organisation who has given an in-principle commitment to deliver the endpoint assessment for this standard. So you might find there will be a slight lapse before you are able to register whilst endpoint assessment organisations are applying to the register and waiting to have that approved in principle for starts to commence as soon as possible. So make sure you look on the, keep an eye on the IFATE website just to make sure when there is an organisation who has been approved to deliver that. Okay, I'll hand you over to my colleague Raman now, just to go through the healthcare and childcare SASE framework.
Hi everyone. So just to go through the similarly to what Dion has just said about healthcare and childcare. So I will start with the healthcare frameworks. Although lots of healthcare frameworks were in the same situation as the adult care and they have already closed, and you probably have already transitioned to some of these new qualifications and new standards, but I just wanted to highlight the qualifications that are available or that were, just in case if you were not in that position before. So for the level 2 clinical healthcare support intermediate framework, the healthcare support worker standard is the transition replacement standard. There is no mandatory qualification for that. However, the level 2 adult care qualification can be used for that because the core mandatory units for the adult care qualification maps this and to the knowledge, skills and behaviours for this level 2 clinical healthcare support as well. The level 3, there were lots of pathways for the advanced framework, clinical healthcare, allied healthcare, maternity and pediatrics and perioperative. So these have all been removed, and the transition standard that is available is senior healthcare support worker. And again, it has got 6 pathways or options, 4 of which, as they map to the old framework, are adult nursing support instead of clinical, Allied healthcare support is the same. Maternity support is similar to maternity and pediatrics, and theatre support for perioperative. And there are two more, which are mental health support and also the children and young people support in the hospitals. So there are two additional pathways. And all of these are covered by single qualification, which is the BTEC Level 3 Diploma in Healthcare Support. And it has got lots of optional units which cover all of these pathways. We currently offer the qualification and the endpoint assessment for that standard. Moving on to the other standards, so Pharmacy Services Intermediate and Pharmacy Services Advanced Framework. So the Intermediate Pharmacy Service Assistant Level 2 standard has been available since last year. There is no mandatory qualification required for this. However, due to popular demand from the centres and also the development of new GPHC Level 2 or pharmacy support staff criteria, we are currently developing the Level 2 diploma in pharmacy support qualification, and it will be available very soon. So that will be aligned to both the GPHC criteria and the Pharmacy Service Assistant Level 2 apprenticeship standard. So it can be used to support the learners who are taking the apprenticeship for their knowledge, skills and behaviours. Pharmacy Services Advanced, the transition standard available for that is a Pharmacy Technician Level 3 standard. It is one of the unique standards as the first one, Level 3, to be an integrated apprenticeship standard. All that means by the integrated apprenticeship standard is that the endpoint assessment components in the assessment plan are part and parcel of the actual qualification, similar to many degree apprenticeship standards which are integrated. So a learner who is taking this apprenticeship cannot achieve this Pharmacy Technician Level 3 qualification until they have completed the two external components of the assessment plan. So that's one of the unique things. So it is going to be very shortly available, the specification for this integrated apprenticeship. However, the on-program part of the 21 units is similar to a standalone qualification, which is our Pharmacy Level 3 Diploma in Principles and Practice for Pharmacy Technician, which is already currently available. So the on-program part is same in the integrated and the non-integrated or standalone. So if you wanted to start delivering this, it would be the same, but it will be soon available to register your learner. So if you wanted to look at and plan, you can do that using that qualification. Moving on to the healthcare support services, a lot of people were using these, again, intermediate and advanced. There is transition standard currently in development for Level 2 or intermediate, which is healthcare cleaning operative. So because it's in development, we have got no offer at the moment, watch this space. There is no transition standard at the advanced level at this moment in time, and there is nothing in development either. Optical retail intermediate standard, that framework that was available, there is an optical assistant standard that is currently available, and there's no mandatory qualification, but the current optical qualification can be used as an optional. There is no transition for, again, the advanced framework for optical retail course framework. The next one is the health pathology support. There is no direct standard that is mapped to it. There are two different ones that can be used. One is the laboratory technician or the healthcare science one. The laboratory technician is currently going through some transition, so I haven't mentioned here. But the healthcare science assistant at Level 2 and Level 4 is available, so it's not similar to the health Level 3 qualification that was available. So it is either at Level 2 or Level 4. We have got qualifications in BTEC Level 2 Diploma in Healthcare Science and Level 4 as well available. They are mandated within the Healthcare Science Assistant and Associate Apprenticeship standards, and they can be used also for the old pathology students. So that's all for the healthcare standards. Moving on to the childcare. Children and young people workforce intermediate framework that was available. There is a transition available, or will be available, I should say, because it's still in development, which is the early years practitioner level 2. The qualification, which from last September, which was required for all level 2 students to do, is the BTEC level 2 diploma for early years practitioner, because it meets the DFE criteria for all the level 2 students to be counted in ratios. So that qualification meets the DFE requirements, and we are led to believe that that's the qualification that will be in the apprenticeship standard. For the children and young people workforce advanced path framework, the early years educator pathway, there is an early years educator standard that is available to transition, and our current qualification, the level 3 diploma in children and development early years educator, is a mandatory qualification that can be used, and we also offer the endpoint assessment for that. For the social care pathway, there is no transition standard available and no transition qualification available at this stage for those learners. The third pathway in that framework was a residential care pathway. There is a residential care standard available, but it's at a level 4. So it's children, young people and families practitioner level 4. It has got 2 options. One is the practitioner in children's residential care, and the other one is the management community. So the option 1, practitioner in children's residential care, is where that same level 3 qualification that was in the framework can be used, and it's mandated. So the reason I haven't mentioned the option 2, because it includes a HE, higher education qualification, which currently we don't offer because it can only be offered by higher education institutions. Last but not the least is Playwork. So Playwork Advanced Diploma framework was the framework that was there, but there is no direct transition. The only one that is there, which is in development, is a Playworker level 2. So watch this space. We shall keep you informed about that when it's available, and all of these others that are in development also when they become available. I'll hand you back to Dion to go through the next bit.
Thank you, Raman. So really, we just wanted to briefly talk to you about the next steps and what will happen from the 1st of August 2020. I'm sure you're all familiar now with standards and what they are, but just a very slight recap. Apprenticeship standards will replace all of the old SASE frameworks. So as you all probably know, the standards have been written by employer-led groups, and they include specific knowledge, skills and behaviours needed for specific occupations. This puts employers in the driving seats, and it gives an apprentice a clear career path to follow. Each standard has to have an assessment plan. The assessment plan is to test the competence against the knowledge, skills and behaviours within the standard. Also attached to this is the endpoint assessment, which you'll often see referred to as EPA. So it's an assessment that takes place at the end of an apprentice's programme of learning. For the framework, apprentices continuously assess throughout their learning. Now what we'll see is an actual endpoint synoptic assessment of the learner and all of the knowledge, skills and behaviours that they've learnt whilst on programme. Okay, so on the Pearsons website we have a dedicated page for apprenticeships, and you'll see this on the slide here. So what we've done, we've got an area where the apprenticeship frameworks are. We've also got an area where the apprenticeship standards are. If you click on the link, you'll be able to, if you click on the standards, you'll be able to find where all of the standards are and where we are with our offer. So particularly if you wanted to know more about care services, we're trying to stick with the categories. Thank you, Erin. The categories that are on the IFA website. So if you look at the adult care worker, for instance, you will see what we have on offer, where the standard is, etc., etc. Everything that you need to know within the on-programme and the endpoint assessment for that standard. And all the resources are there, etc. So have a good look around the website and start looking at the resources that we have already provided for the endpoint assessments that we will be offering. Okay. Bear with me a second. Okay, so the links are there for you. Okay, so also support that we have on offer for you. If you have a named business development manager, you can contact that person directly. Alternatively, we've got the customer services team who are based in Manchester. So their phone number and their email addresses are on the screen for you now. You can call or email if you don't have a designated business development manager to request more information. Or again, if you've got any questions that you've not been able to put in the chat function, do pass them on to those and they will make their way to us. Okay, other support that we've got on offer. During March, Ram and myself are carrying out some face-to-face forums. So really the face-to-face forums are for anybody who's involved in the delivery of apprenticeships in health, childcare and adult care. So the aims of the day, again, we're going to sort of look back at support for transitioning from the SASE to the standards. We're going to look more in depth of the Pearson offer for each standard and endpoint assessment. We're also going to do an update on specialist and professional qualifications, i.e. non-apprenticeship qualifications. Particularly in adult care, we've got the end of life and the dementia qualifications, just really looking at what's going to happen to those post July 2020. We'll also be having a look at digital content offer. We will be launching in March digital content support for adult care worker and lead adult care worker. We'll also in the afternoon be looking at sharing good practice with endpoint assessment with the endpoint assessment quality manager. So the dates are there for you if you want to click on the links. As I say, I know that places are quite limited at the moment. Obviously, if these places are taken up quickly and we do have a reserve list of people, we will certainly be running some more within the next few months. Okay, so that's just really that for extra support that is available to you. Okay, so that's all from us. I hope that it's just been a brief update for you as to what to do from July 2020. Okay, thank you for listening.
Thank you very much.
Oh my goodness.